Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about government policy and human rights. Welcome back to Policy and Rights here in Depictions Media Radio. I am your host, Michael Clogs. And in this next segment, we have Adrian Dix and the health ministers across Canada as they had a meeting about what the future of public health care looks like for Canada and how the federal government can support it and ensure that financially it's going to stay viable and available to all of the citizens of Canada. As Adrian Dix will tell you that the people of Canada want the public health care system to be in place because it supports them. And that they want to make sure that there's enough doctors and nurses and professionals to help with that care. And there's steps to be taken that will ensure that there's enough medical schools and nursing schools to train the professionals needed. And that there will be supports for those who come from outside of the Canada medical system immigrate into Canada that have medical degrees, that they will be supported so that they can find work and adjust into helping serve the Canadian people and their health needs. So he did mention some things where the federal government wasn't necessarily on board just as yet, but he mentions a text message and some other messaging that he got that says that the federal government is going to support with funding and ensure that the public health care system stays in place.
Good afternoon. I'm Adrian Dix. I'm BC Minister of Health. I'm joined by Provincial and Territorial Health Ministers. I'm honored to be here on the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. C'est un plaisir d'être ici avec vous pour la deuxième jour de discussion avec mes collègues, cette fois-ci avec mes collègues ministres de la Santé et cette fois-ci fédérales et provinciaux. Les discussions d'aujourd'hui ont porté sur des nombreux aspects du système de santé publique. Nous sommes quand même à un moment fondamental en termes d'efforts importants que toutes les provinces et tous les territoires ont déployés et continuent à déployer pour recruter, former et retenir des professionnels de la santé. Today we had, as yesterday, significant discussions that touched on many aspects of our public healthcare system. We focused on the health workforce crisis and the efforts being made in every jurisdiction, already announced, already established in terms of the source of money that would come forward in every jurisdiction to support health human resources, the staff, the doctors, the nurses, the health sciences professionals, the healthcare workers we need in the future. We also discussed digital health and health data. public health priority areas and applying lessons learned from the ongoing COVID-19 pandemic, mental health and substance use services, including efforts to address the opioid overdose crisis in many of our communities and our provinces. The significant effort made in these areas is something that I think we need to emphasize. And there are examples in every single jurisdiction. Decisions to open multiple new medical schools and thousands of new nursing spaces by provincial governments committed not for a year, not for 5 years, but long into the future to fundamental change in the way that we fund public health care. Decisions such as the one we made in BC last Monday in agreement with the doctors of BC to fundamentally transform primary care. The efforts in every jurisdiction to improve standards and the quality of life in long-term care, to focus on community care, to address the fundamental questions around mental health and addictions. These were the subject of our work. This is the work we've done over the last number of days, last 2 days, and it was very important to share that work with the federal government and to hear their perspectives and their support for those efforts. It was, of course, an honor to have Minister Duclos and Minister Bennett here with us today. I want to mention now, I guess, the elephant in the room, or in this case, the elephant not in the room, and that is, where we are right now and the end of our discussions today. As all of you are aware, provincial governments have been making the case for a fundamental increase in the Canada Health Transfer. This has been happening for a year. Provincial premiers and ministers have been calling for the federal government to come to the table and have a serious discussion about the future of public health care. Why is this a good idea? The need is obvious everywhere. In every emergency room, in every primary care clinic, in every ambulance service, everywhere in Canada. And we're building on what I think has been a period of extraordinary cooperation between the federal government and provincial governments and territorial governments with respect to the COVID-19 pandemic. It was our belief, certainly Premier Horgan's belief, all the premiers' belief, all the health ministers' belief that this was an excellent time to act, that we had to, as we were coming out of the pandemic, as the value of public health care demonstrated its worth everywhere in Canada, this was an opportunity to have this needed discussion because the demand for services, which we spoke up at length yesterday, in every single jurisdiction was growing, and the provincial governments were making long-term fundamental investments to address especially the health human resources challenges that were both immediate, medium-term, and long-term facing public health care in our country. As you know, for the last year, the federal government has not responded to these requests for a meeting between the Prime Minister and premiers with respect to the Canada Health Transfer. And that is disappointing, but not discouraging, because I believe the moment is so essential for public health care, so important for public health care, that we have to have this moment now, and we have to continue to make the case, to convince, because Canadians understand its value, Canadians believe in public health care, and Canadians want us to act. Yesterday, as all of you know, because you were in this room, we received some comments. I got a text about 12:57 yesterday after we'd had our morning meeting and just before we were going to have our news conference to suggest that the federal government was suggesting that there was more money going to be available under the Canada Health Transfer. The Prime Minister made some comments yesterday. He made some more today, reflecting a number of, I suppose you could call them, views about the issue. And Minister Duclos said there would be more money available. And they spoke of conditions and so on. We responded to that in this room, I think, favorably. Not because we agreed with all of it, but because we saw the first signs of federal engagement on a subject that Canadians and provincial governments and territorial governments have been seeking engagement on for a year. And we were very, I think, positive. We put as they say, the best possible view on that announcement. It, of course, became the subject of the press conference, as these things do. For most of the time after it, we weren't discussing all of the work we'd done in the morning. You didn't ask about that. You were asking about the Prime Minister's comments and Minister Duclos' comments. And if I were a reporter, I would have done the same thing. Last night, we had a dinner meeting with Minister Duclos, and then today we had our meetings where these views were expressed, as well as discussions on all the subjects that I spoke about. At noon today, as members of the media will be aware, and everyone's aware, the premiers of BC and all the other provinces, on the direction of the head of the Council of the Federation now, Premier Stephenson of Manitoba, released a statement that said, in sum, exactly what the premiers have said 1,420 or so times since in the last year, that there needed to be a national conference on the Canada Health Transfer, that we couldn't move forward by small sound bites from the Prime Minister, that we need to move forward in a fundamental way together, working together as we have done with such commitment over the last 2.5 years. So this happened, of course, as the statement by the Prime Minister yesterday happened, in the course of our discussions and as we were working towards a communique and a proposed joint news conference, which ordinarily one would have expected to have. The federal government expressed its disappointment, I suppose, Minister Duclos and others, with the decision of the premiers to reiterate their important position on the Canada Health Transfer. And the federal government chose to withdraw participation from both the communique and from a joint press conference. I want to say that I find that disappointing. There's work to be done, both on the Canada Health Transfer and a lot of other things. And we have been doing that work, in many cases doing that work together. Provincial jurisdictions are fundamentally changing and investing more in our healthcare system. And to succeed in the long run, we need partners in the federal government to join us. However, I am not discouraged. I'm disappointed, of course, because I would much rather, and you would have much rather, had a press conference with all of us and Minister Duclos here where we could have had these issues aired together. And we are going to continue, and I'm going to continue tomorrow and all the days after tomorrow to work with Minister Duclos, as are all of our provincial colleagues. But I would say this, that I think it's not the result that Canadians expect. And I'm disappointed that a communique that would have reflected all of the things that we engaged with together today, and a press conference that would have demonstrated our work together, as well as the need for a major federal infusion of money into the Canada Health Transfer, didn't take place. But I am, as I say, not discouraged. We are going to succeed in this because our cause is right, because Canadians support that cause, because we need to succeed in the future, to build the healthcare system we need the federal government to increase its role and support for public health care and not, as has been happening for too long, diminish that role. We need the spirit that we came together with under COVID-19 to be the spirit that we come together with in addressing the issues around the Canada Health Transfer. And I am convinced that if we continue to do this work, if we continue to make the case, we continue to engage with our federal colleagues, the Prime Minister will agree to a First Ministers' Conference on the Canada Health Transfer, where the changes, the improvements, and the efforts that Canadians demand of their public health care system are given expression and voice by their leaders. And we are going to continue to work every day to see that happens, just as we're going to continue to work on our Health Human Resources Plan, on our response to primary care. I want to say finally that this is, for anyone involved in healthcare, pretty solemn times. We are going to have a very challenging and difficult winter. We know that respiratory illnesses affected the Southern Hemisphere. We know they're going to affect us in Canada, that we have already seen evidence of that, and that evidence is there for all to see. Challenges with the COVID-19 pandemic, with respiratory illnesses in general, and we are seeing the effect of that everywhere. So we are determined to continue to do that work, to respond to Canadians' need for more health care at a time after 2.5 years of pandemic that so profoundly affected people and meet all the challenges we're facing in healthcare. And je veux dire, finalement, ma déception aujourd'hui de la réponse du gouvernement fédéral. Il n'y a aucun détail sur le montant d'argent. Il n'y a aucun détail sur la route devant nous. Et le gouvernement a décidé, après une décision de la part des premiers ministres provinciaux, de présenter encore une fois leur position sur le Canada Health Transfer, en décidant de ne pas participer à un communiqué commun sur notre travail commun. Et personnellement, je suis déçu, mais pas découragé. Nous avons une détermination fondamentale d'aller en avant, de faire le travail. S'attendent de nous. Et nous allons continuer à faire ce travail ensemble, d'une manière unanime de la part des provinces et des territoires du pays. Et je suis j'ai beaucoup d'appréciation, plus d'appréciation même pour mes collègues et le travail qu'on a fait ensemble depuis 2 jours et depuis des années. Merci beaucoup. We're happy to take your questions.
Thank you, Minister. We'll now take media questions from the room. If you wish to ask a question, please do so from the floor mic. Please state your name, media outlet, and to whom your question is directed. You'll have the opportunity to ask one question and a follow-up. Veuillez indiquer votre nom, votre média et le destinataire de votre question. Vous aurez la possibilité de poser une question avec un suivi. Nous allons passer maintenant à la première question.
Bonjour, Christian Noël de Radio-Canada. Ma question s'adresse à M. Dix et à M. Dubé aussi, s'il vous plaît.
Oui.
M. Duclos n'est pas avec nous aujourd'hui, donc ça signifie que les progrès auxquels les Canadiens s'attendaient n'ont pas eu lieu. Qu'est-ce que vous avez à dire aux patients aujourd'hui à la maison qui attendent pour des médecins de famille, qui attendent à l'urgence et qui voient que le gouvernement fédéral et les provinces sont incapables de s'entendre?
Premièrement, que je dirai pas encore, mais le travail continue et on va s'efforcer à faire du progrès. Mais aussi qu'au Québec, qu'en Colombie-Britannique et partout au Canada, les efforts s'accélèrent et les provinces et les territoires s'accélèrent leur réponse à la crise actuelle. Et on l'a vu presque quotidiennement, cette démarche de la part de toutes les provinces et tous les territoires du pays. Et ce travail continue. Ce travail essentiel continue. Et nous espérons que le gouvernement fédéral, qui a fait un gros travail pendant la pandémie du COVID-19 depuis 2 ans, va nous joindre, et je pense qu'ils vont nous joindre, mais pas aujourd'hui. Et il y a une déception, mais je dis à tout le monde que nous travaillons avec toutes nos forces, de faire les changements nécessaires, les mesures nécessaires, que ce soit le plan de M. Dubé et le gouvernement du Québec, le plan du gouvernement d'Alberta, surtout sur la question des ressources humaines. Donc, ce travail continue. Ce travail a beaucoup bénéficié de nos efforts ensemble et encore avec le gouvernement fédéral depuis 2 jours. Et nous sommes déterminés de continuer à faire mieux. Après 2 ans de pandémie, les défis sont énormes pour tout le monde. Et la réponse est énorme aussi. Et ce dont nous avons besoin, c'est un gouvernement fédéral qui va travailler comme le gouvernement fédéral a fait depuis 2 ans sur COVID-19, va travailler à nos côtés sur ces questions et en faveur des Canadiens en général. M. Dubé?
J'ai toujours un côté un peu plus optimiste, même si on est déçu que ce ne soit pas le résultat qu'on attendait aujourd'hui. Moi, j'ai eu l'occasion, avec tous mes collègues des provinces, de voir comment on n'a pas attendu l'argent du fédéral pour faire avancer nos dossiers. Alors, quand vous demandez comment les patients devraient réagir à ça, je pense que tous les Canadiens, puis je parle pour les Québécois, de voir oui, on attend de l'argent du fédéral qu'on a besoin, mais en ce moment, on n'attend pas de faire les investissements nécessaires. Ça, c'est important pour eux, de savoir qu'on va le faire. Maintenant, est-ce qu'on pourrait l'avoir plus rapidement, cet argent-là, pour faire d'autres actions qui sont encore plus importantes? La réponse est oui. Alors, je vous dirais, d'un côté, moi, je pense que ce que je retire beaucoup de cette première conférence-là à laquelle j'ai participé, c'est de voir la force de la cohésion au niveau de toutes les provinces et les territoires, que ce soit l'Ontario, l'Alberta, les territoires, les maritimes. Tout le monde en a le même objectif, c'est de dire au fédéral, écoutez, on peut faire la job, mais en ce moment, on a besoin de votre aide, puis on a besoin de l'avoir sans condition. Parce qu'en ce moment, nous, on n'attend pas des conditions, on fait des investissements qui sont souvent au-dessus de notre tête, qui sont beaucoup plus importants que ce qu'on devrait le faire. Et ça nous prend l'aide du fédéral. Alors aujourd'hui, il y a une déception. On va continuer à travailler comme M. Dix l'a dit, et je pense que toutes les provinces vont pouvoir faire la même chose.
En même temps, est-ce que vous ne comprenez pas le sentiment du ministre fédéral qui, alors qu'il est en train de discuter avec vous, il y a un communiqué qui sort qui dit qu'il n'y a pas de progrès, alors qu'il travaille, j'imagine, à faire des progrès. Est-ce que vous ne comprenez pas la frustration du gouvernement fédéral de voir une conclusion avant la fin?
Je vais laisser M. Duclos répondre à ça. Mais la demande des premiers ministres et du Conseil de la Confédération, M. Dix, elle est claire depuis 1 an et demi. On n'a même pas été capable de savoir ni les montants, ni les conditions. Alors, aujourd'hui, on a dit, on ne peut pas aller plus loin, puis le fédéral a pris la décision de ne pas être là. C'est son choix. Merci beaucoup.
Next question.
Hello, Ben Milger, CTV News, Vancouver.
Hi.
Minister Dix, we heard from a deputy minister from in the federal health minister's office that the sticking points for them were the fact that the provincial and territorial ministers could not agree to the health and human resources and the digital health and health data items that were part of the plenary. What were the sticking points for the ministers that caused you to not support those two?
Well, first of all, there was going to be a communique. And the reason there's not a common communique about our common work together, is because the federal government didn't want to join the communique. And that's disappointing. But it's not the most important thing. I mean, the most important thing on both those questions, every provincial jurisdiction has put forward massive investments, as Denise Dubé has just said, often comprehensive into the future. When you have provincial governments starting new medical schools, that's an investment decades into the future. And so I'd say with great respect to the federal government, they need to join us in that. And I find, and they made the decision to not participate here today, and that's disappointing, but I don't think it's the most important thing. I think, and I believe, there's going to be a deal on the Canada Health Transfer. And there's going to be a deal because we have every jurisdiction in the country, all 13, coming together to make fundamental and important and long-term investments in public health care, investments that will require the support of the federal government for us to be successful over a long period of time. Because in Canada, the federal government has the taxation powers, or the disproportionate taxation powers, and we have the jurisdiction, and we're working within that jurisdiction. So I'm optimistic that we can make changes. The idea that the federal government wasn't working on a communique until they were unhappy about the Premier's announcement today, I mean, that's just what happened. And fair enough, they didn't like that the Premiers reiterated their position on the Canada Health Transfer. That's entirely fair of the federal government to do in their expression, but I think it's disappointing. I'm not sure it sends the best message. But in any event, I'm not concerned about that. We're just going to continue to do the work to build out our healthcare system, to make the massive investments required, the ones that you've seen in the last few weeks in BC and countless other jurisdictions in the country. We're just going to continue to do this work. But the idea that there was some sticking point in the morning when what happened and I would say disappointingly, is we were going to reflect on the work done and the work that has to be continued to do on those subjects and others. And they're not here. But it's not the most important thing. The most important thing is that we deliver care for Canadians. And we come out of this meeting as provincial and territorial governments, and in our discussions with the federal government, stronger because of our cooperation, our work together.
Follow-up?
Well, you and the other territorial and provincial ministers and the premiers engage in finger-pointing with Ottawa. It is frontline workers and patients who continue to suffer. So after today, what do you say to patients and their families who are not getting the health care they expect?
Well, with great respect, it's on behalf of those patients that we're making the case for a fundamental federal investment in public health care in our country. The necessity of that has been demonstrated in the pandemic and before, that we cannot, when one of the partners is playing a smaller and smaller role, make the progress we need to make. But what I would say is this: we're making the changes. Right? Last week, just saying, we talked about this yesterday, so I apologize for repeating it. But on last Monday in BC, we put forward a fundamental reform to primary care, $704 million annualized in the third year for that reform of primary care that we worked on with the province's doctors. That's investment. You look at the plan put forward by other ministers, the foundational work in our territorial governments on cultural safety, the work on health human resources, more nurses in Alberta, more nurses in Saskatchewan, more nurses in Manitoba, more nurses in Ontario, more nurses in the territories, more nurses in British Columbia, more nurses in New Brunswick, more nurses in Nova Scotia, PEI, and Newfoundland, more nurses everywhere. That work continues because nurses have told us we need to train more nurses, and we are. That we need to make workplaces safer, and we are. That we need to make pathways easier for internationally educated nurses, and we are. Now, the federal government can help in some of those things. We talked about them today. But I think that we need to continue to do that work. Those are the things that matter to people. And when we put in new safety systems in our hospitals for nurses, that's progress, and that's what people want to hear. And they're going to hear from provincial governments right through that progress. And I believe, ultimately, we're going to hear from the federal government that they're going to support that with more resources as well, because it is the right approach for now to invest in frontline workers. And I remind you that CIHI keeps statistics of that. It's called the Canadian Institute for Health Information. We as provincial governments are spending less money on administration and more money on frontline care in spite of the demands of the pandemic and the incredible demands of delivering health care in a vast country such as this. And so when people ask, where's the money going? Is it going to go to health care? You bet it's going to go to health care. It's always gone to health care, and it will again.
Next question.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.